One of the most common mistakes in prosthetic alignment results from insufficient consideration of the hip flexion contracture. When a hip flexion contracture is present, the residual limb cannot achieve full extension. Therefore, it is important to take the measured hip flexion contracture into account during prosthetic alignment by incorporating the appropriate amount of socket flexion. Sufficient socket flexion helps prevent hyperlordosis and back pain and ensures proper prosthetic performance. Here we use the Thomas test to measure the angle at which compensatory movements become necessary to manage this limitation. First, locate and mark the femur. Then, identify the top of the greater trochanter to determine the hip joint center. Slide one hand under the lumbar spine. Have the user pull the sound knee towards the upper body and make sure the residual limb rests in a relaxed position. Move the residual limb with the other hand while the user keeps the hip muscles relaxed. Push the residual limb into adduction and move it up and down. Then lower the residual limb in hip extension until you feel the pressure on your hand reducing in the area of the lumbar spine. This is the angle at which the compensation movement starts. Now measure the angle between the residual limb and the treatment table. Repeat the procedure a few times and use the average of the measurements to get the final result.